Hi, I'm Frank Peacock. I'm attending the American College of Cardiology meeting and presenting data on patients with atrial fibrillation and diabetes who are receiving Rivaroxaban. This is a trial of post-marketing surveillance study of about 50,000 patients, and in that cohort about a third have diabetes. And this is really important because patients who have diabetes, it's part of the CHAD score, and the CHAD FAST score, have a much higher risk of stroke than non-diabetics. But as the CHAD score goes up, we know the risk of bleeding goes up. What has been done in entire populations, the risk of stroke always markedly exceeds the risk of bleeding. We're looking at the subset here to ensure that the diabetics do not confer a special risk. So when we looked at that population, the diabetics do have a slightly increased risk of bleeding. It's 3.5 per 100 patient years. You always have to do this in terms of exposure. If someone's on Rivaroxaban for a week, it's way different than if it's on for a year. So it's about 3.5 per 100 patient years compared to 2.5 per 100 patient years if you're not a diabetic. So they do confer a little bit of risk, but I also want to put that into context. These bleeds tend to be GI, just like all the other NOAC trials. There's a more likelihood of GI bleeding. The intracranial hemorrhage risk is no different than in the non-diabetic, and it's very low. And the fatality risk is extremely low. It's 0.09 per 100 patient years. And I want to put this in context of how this should affect your treatment. If you're a CHADS 2, you have a risk of stroke of 2.8%, about 3% per year. So if you put that number into the same format as the risk of death, it's 3 per year, 30 per decade, 300 per 100 patient years. The risk of death, if you're a diabetic on Rivaroxaban with AFib, is 0.009 per 100 patient years. It rounds up to about 0.1. So if you're not using an anticoagulant, Rivaroxaban, in this population, you're choosing to give 300 people strokes instead of one person, 0.1 person per 100 years, having a death. So the overwhelming data is for anticoagulation. So that's how the study came out. It's a real-world study in a large number of patients. So I think that from that perspective, we should be reassured that Rivaroxaban is safe in this population, and the efficacy data looks pretty consistent with what we've seen in the large randomized controlled trials.